Hi, my name is Dr. Noelle Cloven. I'm a gynecologic oncologist with Texas Oncology in Fort Worth. And as a kickoff to the GOG's Cervical Cancer Awareness Month, I'm here with Morgan Newman, who is a cervical cancer survivor and a patient advocate. Hi, Morgan.
Hi, Dr. Cloven. How are you?
I'm good. I welcome. Thank you so much for joining us today. I guess we can start off by talking a little bit about how we met.
Of course, and thank you for having me. I think, let me see, when we first met, it was back in July at the NRG Oncology Conference in Chicago.
Yeah.
And I was one of the fortunate patient advocates to receive Mary Dicey Scrogan's travel scholarship and attend the conference. And you've been so helpful throughout that conference on kind of, navigating where we should be or what meetings to attend and how things are logistically. So it helped tremendously.
Thank you. Yeah, it's really nice to be able to, kind of showcase what we do and, really, how things happen. And I just love seeing it through a patient's eyes, and also getting feedback and perspective. It's such just a great interaction because, we're all here working together for the same goals. So that for me too, it was a great experience. So,
Absolutely. And as a patient advocate, I wasn't aware of everything that went into it. So it was really cool to see the workings of it coming together. And man, it's a lot of work.
well, would you care to share your cancer story with us?
Sure. My cancer story started when I was 24 years old. I was always one who went in for my regular screenings starting at a young age. I wanted to take charge of my health and really make good decisions. And I ended up having my first abnormal pap and ended up going in for further testing, colposcopy, and I found out as I was hemorrhaging on the table that I needed to be referred to a gynecologic oncologist. At that time, I really didn't know what that meant for me. I wasn't connecting the dots on what oncologist meant. So I ended up going to the oncology appointment by myself, and I was diagnosed with stage 3B adenocarcinoma. And ironically, it was on World Cancer Day. So February 4th of 2015, actually. And then I went through treatment and ended up with a metastatic recurrence to my lungs. And at that point, I got really frustrated because I didn't know much about cervical cancer. It was a very grueling process to go through when it came to treatment. But I wanted to do something to make my voice count. So I ended up finding a patient advocacy organization to join. And I have been going on 7 years cancer free now. So doing well, but it's not a typical case that you hear about. I'm just very fortunate.
Right. Well, that's an amazing story. I guess, there's just a couple of points that it brings to mind to me. One is that cervical cancer can affect women of any age. I think that's something that, a lot of people don't think. A lot of women think, well, cancer happens when you're older, but that's not always the case. It can affect any woman. And the other thing is some cervical cancer happens in people that are getting screened. People think, well, as long as you get your pap smear, as long as you get the vaccine, everything's going to be fine. But really, you need to be an advocate for yourself. So let's say, for example, you've always had pap smears, but you're having symptoms that are a little bit unusual for you, like bleeding, after intercourse or irregular periods. You still need to go get checked out. And it sounds kind of basic, but you also have to insist on getting a pelvic exam sometimes. It's amazing to me how reluctant, some healthcare providers are to look down there, I guess, for lack of a better word. So I think those are the two things that struck out. And then the other thing is, as a gynecologic oncologist myself, I see that, a lot of people don't know that we exist. And we're, physicians who are trained specifically to take care of women with gynecologic cancer. So if you have cervical cancer, no matter what stage, I think it's very important to be seen by a gynecologic oncologist. That's really important. So
Absolutely.
yeah, so those are just the points that I kind of gained from that story. So what would you want people to know about cervical cancer?
We're the only cancer as of right now that has the testing and the vaccine to prevent it. And we can do this for future generations. Is it bulletproof? No, but it's a step closer to what we're experiencing now. And the pandemic has really kind of made things delayed. So I feel like we're seeing an increase of late stage diagnoses. And it's something that we need to work towards, educating our general population just how common HPV is, how it can be linked to cervical cancer. About 90% of cervical cancers, and just education on getting screened and what those recommended guidelines are. Having that shared decision making with your provider is so important, because as I mentioned, I was 24, I was naive, I didn't know. And had I had that education, maybe things would have been a little bit differently. Because you did mention a symptom of cervical cancer, which was bleeding after intercourse. That is something I experienced, but I never thought it was anything serious. I thought it was something to do with how my cervix sat in my pelvis. I've always had some sort of remark from my provider saying your cervix is tilted a little.
Mm-hmm.
So I always thought it was attributed to that. But had I not gone and received that screening, I wouldn't be here today talking with you.
Right. Right. Yeah, no, I think that is it. So it's the only gynecologic cancer that we have a screening test for, and, and a vaccine, a cancer vaccine. So it is really important to do for every woman to at least know what you can do to decrease your risk. You're right. It's not foolproof. You still have to be aware of yourself and go to the doctor. But I think that is so important for everybody to know during this month. So if you're listening and you haven't had a pap test or an exam in a while, or you're kind of wondering if there's something wrong, go in and get it checked out.
Yes.
So I think we've already really taught, one of the questions was what causes cervical cancer and how can we prevent it? I think we've discussed that. Maybe just reinforce some of the points, I guess.
Yeah, I mean, cervical cancer is the fourth leading cancer worldwide. In the US, about 14,100 women will be newly diagnosed, and 4,200 will die from their cervical cancer. And we're seeing a lot more women who are being diagnosed in different ethnic backgrounds, and they're dying at twice the rate. So it's really, truly something we need to educate our population on, is just how common HPV is. Almost all of us will have it at some point in our lifetime. There are the very rare cases that cervical cancer isn't caused by HPV, but we know for the majority it is caused by HPV.
Yeah, and we've made so much progress with our efforts. I mean, cervical cancer, still is the leading cause of cancer death in underdeveloped countries. So that's something else to think about. This is a global sort of problem that we have. So what can people do to fight this disease? We've talked about the vaccine. We've talked about getting screening. What would you tell, as an advocate, that patients should do specific steps?
Yeah, I would say, have the conversations with your providers. If you don't feel like you're getting the right information or treatment or anything like that, seek a second opinion when it comes to that. But a great conversation to educate yourself on HPV and cervical cancer is great. Make sure you're using reputable sources, the CDC, World Health Organization, American Cancer Society. I mean, they're all great resources. There's organizations like the one that I work for, Survivor, we're a cervical cancer organization founded by a cervical cancer survivor and run by cervical cancer survivors. And it's our mission to educate those people impacted by cervical cancer, but also the general population. And we work very closely with providers like yourself to make sure that we're not doing this work by ourselves and that we're not missing anything, because it truly takes a village to get this messaging across, to make sure that we're not leaving anyone out, and that we're really truly doing the best that we can. But we do have a ways to go when it comes to the education aspect, and just having conversations with our friends and family about it. Like, hey, have you had your screening yet? I mean, we can prevent cancer.
Right.
Don't let your busy schedule get in the way. And as women, we have so many different roles that we play. I'm not a mom, that got taken from me with cervical cancer. I have actually 3 fur children now. But we take on those responsibilities and then we don't take care of ourselves. We put
Right.
everyone else ahead of us. So really, truly having those conversations, and making the effort to schedule them.
Yeah. Really easy to put it off. I mean, even for me
Yes,
as a doctor, sometimes like, oh, I got to do that.
yes, yes.
But
Make
yeah,
that
you
phone call.
got to keep up with it. So,
We do. And, mark it on the calendar
right.
whenever you need to. Just do it. It could really, truly save your life.
Exactly. So as an investigator with the GOG, clinical trials are close to my heart. And I really feel like the treatments that we have today and the improvements that we've made in survival, especially for women with metastatic cervical cancer, are all related to previous clinical trials. So if you don't mind, would you just speak a little bit to the importance of clinical trials from a patient perspective?
Yeah, 100%, it provides hope. When I first started my cancer experience, there wasn't much past what there is as standard of care. And over the past like 6 years, 7 years, you have seen so many like clinical trials popping up for the metastatic and recurrent disease states. And it has prolonged several members in our community's lives. And it helped me. I had a chemo cocktail that we supplemented another, medication in to help and see if it would present any results, and it did. And had I not sought that second opinion, again, I may not be here. But it's truly giving people like me more of an opportunity to live their life longer, to improve quality of life, and ultimately have more time with their family.
All right. And I think, we're looking at a lot of new treatments that, are more specific and more targeted than just chemotherapy and radiation. Some of, 2 of the new drugs that were approved by the FDA just in the recent years. You know, one's an immunotherapy drug and the other one is a new class of drugs called an antibody drug conjugate. So there's some really exciting science going on. It's just, it's exciting to me to see such good results. So I think it may be time to wrap it up. Did you have, Morgan, anything else to add? I guess, how can people get involved this month?
Yeah, so obviously, you know, January is Cervical Cancer Awareness Month, and there's plenty that's going to be happening in the survivor world, and that's CERVIVOR. You can visit our website and our platforms, survivor.org. We're across all major social media platforms, but we'll be sharing survivor stories, medical information, you know, with our partners, and we're putting on several events, but we could always use the support of our community partners like you guys, and help amplify what we can do, educating the general population, you know, making sure that we're having those important conversations and making sure that we're urging people to schedule those appointments and, you know, start the new year off right in a healthy way. So obviously, you know, we have several things going on, but in the thick of it, you know, just support each other and you know, educate yourself on the best ways to prevent cervical cancer.
I love the name Survivor, CERVIVOR. That's great. So, well, thank you so much for sharing your story and giving us insight. And at the end, you know, we're going to have a, you can also look at the GOG Foundation website. If you are interested in clinical trials, there is a trial search where you can, you know, look and see what trials are available in your area. So, remember, know what your risk is, know what you can do to prevent cancer, and make sure you get your exams and listen to your body. So thanks everybody for joining us.
Thank you.